With the readout of the college meeting we had today, we at the beginning adopted a communication on HERA Incubator. We will in a moment discuss that with you. The college also discussed an action plan to enhance the synergies and build links between the civil defense and space industries. We discussed as well our communication on trade. With it, we are defining a new direction for an open, sustainable and assertive trade policy aligned with our strategic interests and priorities. Then we adopted a joint communication together with the High Representative on strengthening the EU's contribution to rules-based multilateralism. The EU believes that rules-based multilateralism is indispensable to deal with the challenges the world faces today. So we must use our influence to ensure that it is up to the task. And then, as every week, HRVP Borrell also briefed the College on the latest developments in the international arena. Finally, I'm glad to announce that today the Commission has approved a second contract with Moderna to purchase 300 million additional doses of their vaccine against COVID-19. This is good news, and this builds the bridge to the topic which we will be presenting to you today. Nous présentons aujourd'hui la nouvelle étape de notre stratégie pour combattre le coronavirus. Comme vous le savez, la vaccination progresse. À ce jour, environ 33 millions de doses ont été livrées. 22 millions de personnes ont reçu au moins une dose, dont 7 millions une deuxième dose. Nous devons et nous allons accélérer la vaccination dans les semaines et les mois à venir. La livraison des 3 vaccins approuvés va augmenter. De nouveaux vaccins seront disponibles dans un avenir proche après l'approbation avec l'EMA. Cependant, la situation évolue. Nous voyons de plus en plus de cas de Covid liés à des variants. Et des nouveaux variants du virus émergent encore en Europe ou dans le monde. Jusqu'à présent, les vaccins approuvés en Europe semblent être efficaces contre les variants, mais ces variants sont plus infectieux, c'est-à-dire plus il y a des contaminations, plus il y aura des variants possibles et ces variants pourraient être plus résistants aux vaccins existants. The increased spread of the new COVID-19 variants, first identified in the United Kingdom, South Africa and Brazil, are a potential paradigm shift in the global fight against COVID-19. Over the past weeks, EU countries have observed a substantial increase in the number and proportion of COVID-19 cases caused by these variants. Looking at the evolving situation, we just know how much time and structures are of the essence. And this is why we are today presenting the HERA Incubator. It is a new public-private cooperation pooling the knowledge and the resources of industry, of the research and science community, of the whole health sector, and public authorities and regulators. The aim is to use our combined strength to get ahead of the curve for the next phase of this virus, from the early detection of the new variants all along the whole chain up to the rapid mass production that is necessary if we have adapted second-level or second-generation vaccines. The good news is we have a lot to build on and a lot to learn from. We know what works well, and equally we know where there were delays, disruptions and bottlenecks the first time round. And with this in mind, HERA Incubator will focus on 5 main priorities. First of all, it's the sequencing. To identify variants quicker, we need to know more about the many possible facets of this virus to be able to combat it. Second, if necessary, Science has to adapt the existing vaccines, so we have to focus on the research. Third point, we need well-organized clinical trials to have evidence-proof data fast. And that is why we are launching today a European clinical trials network. Fourth point, we need to enable EMA to fast-track the regulatory approval of updated vaccines and manufacturing sites. And fifth and finally, we need to further upscale mass production of new vaccines, but also of existing vaccines. On all 5 areas, the Commission will channel organizational and financial support through the HERA Incubator. We will focus on improving information sharing. This is of utmost importance among the stakeholders, on planning and coordination in the detection and the response to the new variants. Stella Kyriakides, the Health Commissioner, and Thierry Breton, the Commissioner for the Industry, will speak about it in more detail. Lassen Sie mich zum Schluss an dieser Stelle noch einmal die dringendsten Maßnahmen hervorheben. Erstens das frühe Erkennen der Varianten. Wir müssen die Genomsequenzierung in der Europäischen Union schneller und umfassender anlegen. Für uns ist wichtig, dass der HERA Incubator ganz eng mit ECDC und den Mitgliedstaaten zusammenarbeitet, um vor allem die Kapazität des Sequenzierens zu erhöhen und um neue Covid-Tests in großem Umfang zu nutzen. Der zweite Baustein ist, dass wir die Unternehmen unterstützen werden, wenn sie Impfstoffe an neue Varianten anpassen. Das ist also die Forschungsarbeit, die dahinter steht und die permanent weiterlaufen muss. Dazu werden wir in einem ersten Schritt 150 Millionen € für Forschungsprojekte zur Verfügung stellen, um genau diesen forscherischen Prozess zu unterstützen. Der dritte Punkt sind die klinischen Studien. Wir müssen in der gesamten Europäischen Union die klinischen Studien mit dem Blick auf die Impfstoffe für Covid besser koordinieren. Ich freue mich, dass wir heute ein EU-weites und von der EU finanziertes neues Netzwerk für klinische Studien aus der Taufe heben. Etwa 16 Mitgliedstaaten sind beteiligt und über 180 verschiedene Teilnehmer von Krankenhäusern bis zu Arztpraxen sind hieran beteiligt. Das ist das allererste europäische Studiennetzwerk mit Blick auf Corona-Impfstoffe. Für uns ist wichtig, wir haben damit einen hohen Standard. Wir haben eine bessere Datenqualität, bessere Datenerhebung und vor allen Dingen den schnellen Fluss der Daten zur EMA, die dann dort zur Verfügung gestellt werden können in Echtzeit. Viertens, die Marktzulassung für verbesserte Impfstoffe müssen gestrafft werden. Das ist möglich, weil wir die Technologien, zum Beispiel die mRNA-Technologie, die dahinter liegen, inzwischen gut kennen. Das heißt, es muss nur die Anpassung beurteilt werden und nicht mehr der Impfstoff im Grundsatz. So wird in der Regel bei den Grippeimpfstoffen verfahren, die auch jedes Jahr angepasst werden müssen. Gleichzeitig müssen wir die Zertifizierung neuer Produktionsanlagen beschleunigen, weil auch das wichtig ist im Prozess der Herstellung. Und deshalb wird die Kommission den Rechtsrahmen in diesen beiden Bereichen anpassen. Fünftens, ganz wichtiger Faktor, wir müssen sicherstellen, dass wir kurz- und langfristig in Europa über ausreichende Produktionskapazitäten verfügen. Der HERA Incubator wird mit der Industrie zusammenarbeiten, damit ein Netz von Produktionsanlagen geschaffen werden kann, die dann gewissermaßen auch potenziell auf Abruf zur Verfügung stellen. Das heißt, wenn man die Produktion hochfahren muss, dass dieses schneller geschehen kann mit stabilen Prozessen und trainiertem Personal, als das bisher der Fall ist. The pandemic has shown us 3 things. We have to act early, we have to invest at large scale, we have to partner up. This is why we are proposing HERA Incubator now. And this is the message I will take to the next week's meeting with the heads of state and government, the EU leaders. I will call on them to endorse this proposal and support its rapid implementation. Thank you very much. And Stella, perhaps you want to take the floor.
Thank you, President. Good afternoon, ladies and gentlemen. Well, as the President has already said, the past year has really shown us what we can achieve when we're working together, but it has also highlighted the many challenges that we have been faced with. And one of these are the new and emerging threats that are at present or emerging on the horizon. Variants that can really impact on our decisive fight against the COVID-19. Here I'd like to immediately underline that it is important to understand that our authorised vaccines continue to be the principal line of defence in the long term. And our authorised vaccines are at the moment effective against the variants that we are aware of and are present in the EU. But variants by nature mutate, and our defences need to evolve with them. So we need to act decisively, we need to act collectively. And this is what the HERA Incubator is. It's our targeted response, focusing on three main axes. The first one is what needs to be done for the rapid detection of new variants. The President has already highlighted the importance of the diagnostic side and of sequencing. All Member States need to have the capacity to have a sequencing of about 5% of positive results. And to give you an indication, the figure stands now at approximately 1%. And we are here to support this effort, making available laboratories in collaboration with ECDC through a quick exchange of information. We also need to, and we will be supporting the development of specialised PCR tests in order to detect samples and detect new variants. And we'll be making available about €75 million funding for this. The President has already mentioned the new EU-wide funding vaccine network, Vaccelerate. This will ensure that trial networks across the EU test vaccines in a streamlined regulatory approval process. We need to understand, and only research can really do this, with a network that goes across Member States, how the transmission of variants, how these develop, whether current vaccines can deal with the variants. So this will all be seen through this Europe-funded vaccine trial network, Vaccelerate. The second axis of our HERA Incubator concerns the advanced purchase agreements for the next generation of vaccines. What we need to do in order to, if we need to do update or conclude new agreements with vaccine producers. Our approach to help de-risk investments in the early development of vaccines in the production of vaccine candidates has shown its worth. And we now need to build upon this. Companies who have already developed COVID-19 vaccines are already monitoring the efficacy of their vaccine against the variants. Of course, a prerequisite on our side will be to see the capacity of companies not only to produce in the EU, but also for a credible and reliable timescale for delivery. And we will be there to support and mobilise all necessary funding for these updated or new agreements. And last but definitely not least is the regulatory process to enable the conditions for delivery and what we need to do. And we need to have fully future-adapted vaccines to be approved as quickly as possible through streamlined and predictable procedures that also allow citizens to feel safe and to build up trust in public health matters. No compromises will be made in terms of the safety. The European Commission, EMA and the Member States continue to work making use of the flexibility that we can for the authorisation of vaccines, but we also need to look at how we can use these regulatory procedures and what we need to change for the vaccines that will be addressing the new variants. EMA was already developing guidelines for developers on what their requirements will be needed, and also for the early involvement of the regulatory authorities for the certification of new production lines. So this is work that is already ongoing. We are ready to go one step further and to propose an emergency authorisation of vaccines at EU level with shared liability among us, if there's a decision by the European leaders to move in this direction. So, together with EMA, we will ensure that manufacturers and developers get production off the ground as quickly as possible when necessary. I will end here. I just wanted to end by saying that the HERA Incubator is really the precursor and the strong nucleus for the future European Health Emergency Preparedness and Response Authority. We knew that this was missing in the structures that we had in place, and we are now acting upon that today. So thank you very much.
Thank you, Stella. Now, Thierry.
Thank you very much, Madam President, and thank you for this presentation. As you said, today we are here to present our European strategy against the threat of variants. And we all understand that it's for real, and that we need to be prepared for this, and that we need to anticipate. If you allow me, I will now switch in French. Pour vous dire que, bien entendu, en ce qui me concerne, je vais donc vous parler du troisième volet. C'est après le volet scientifique, après le volet de la mise en disponibilité des données, après le volet du séquençage, après le volet évidemment de l'adaptation des organisations de santé à ces nouveaux variants, à ces candidats qui viendront, qui sont déjà des contractants avec nous. Eh bien, c'est le volet industriel. Et le volet industriel, c'est, pardon cette expression, pas une mince affaire. Rien n'est une mince affaire dans cette course de vitesse dans laquelle nous sommes engagés. Le côté scientifique, on peut dire qu'il a réalisé des exploits extraordinaires. Voilà donc que 10 mois après l'annonce par l'OMS de la pandémie, nous avons plusieurs vaccins qui fonctionnent. Quand je dis plusieurs, c'est 4, 5, et tous, Madame la Présidente, en tout cas, une grande partie de ceux qui fonctionnent, font partie du portefeuille, ont été sélectionnés parmi la centaine de candidats qui s'est présenté à nous. J'ajoute également que sur ces vaccins, une grande majorité a été développée en Europe, avec des fonds européens, et depuis un certain temps. Et c'est un peu notre fierté aussi, je dois le dire, que l'Europe, par le financement de sa recherche, auprès des biotech, mais pas que, a participé à cet effort mondial et quelque part à cette avancée scientifique. Mais voilà, on entre maintenant dans la deuxième phase. Cette deuxième phase, c'est la phase industrielle. C'est celle que vous m'avez confiée, Madame la Présidente. En tout cas, de superviser, de faire en sorte que tous ceux qui se sont engagés à nos côtés eh bien, puissent désormais délivrer, fournir ce à quoi ils se sont engagés. Je ne vais pas donner trop de chiffres, mais juste pour planter le décor, si vous permettez. De quoi parle-t-on? Depuis le début de la pandémie, depuis que les vaccins existent, on a livré dans le monde 178 millions de doses. C'est beaucoup et c'est peu. C'est beaucoup parce que c'est un effort considérable au niveau de la planète. C'est peu parce que nous sommes 7,8 milliards d'habitants. Aux États-Unis, 53 millions de doses ont été livrées. En Chine, ce sont 41 millions de doses qui ont été livrées. Et chez nous, en Europe continentale, ce sont 33 millions de doses. C'est vrai qu'on a démarré un peu plus tard parce que nos agences de santé, c'était là, ont des critères extrêmement stricts. Je ne dis pas que les autres ne les ont pas, mais c'est vrai qu'on a démarré un tout petit peu après, bien sûr, les Américains et les Chinois. Voilà de quoi nous parlons, voilà de quoi nous partons. Alors maintenant, évidemment, les usines. Parce qu'il faut fournir, il faut produire ces vaccins. Et vous l'avez tous compris, produire des vaccins, ce n'est pas une mince affaire. C'est très compliqué, ça nécessite des précautions, évidemment, considérables. Et du reste, fabriquer une usine de vaccins de but en blanc, en partant de zéro, c'est en gros entre 4 et 5 ans. Donc on ne pouvait pas se le permettre. Donc la stratégie qui a été adoptée par la Commission européenne, et je dois dire aussi par un certain nombre d'autres pays, c'était de partir de l'existant, c'est-à-dire de la base industrielle qui était existante, et pour nous évidemment en Europe, et c'est pas rien parce que nous sommes un continent industriel, je ne cesse de le répéter. Et nous avons nous accompagnons les entreprises pour qu'elles augmentent la capacité de production, pour certaines du reste qu'elles innovent totalement, parce que je rappelle que dans les vaccins qui ont été validés jusqu'à ce jour, c'est-à-dire des vaccins à ARN messager et des vaccins à adénovirus, c'est la première fois qu'on fabrique à une telle échelle ces deux types de vaccins. Personne ne l'avait fait auparavant. Pour montée en puissance des usines existantes, il faut en gros 18 mois, 2 ans d'habitude, en temps normal. Nous ne sommes pas en temps normal. Certains, je ne prends pas ces termes à mon compte, mais parler de l'économie de guerre, je ne le prends pas à mon compte, mais c'est vrai qu'il faut vraiment qu'on se donne les moyens d'aider les entreprises à réaliser, je n'ai pas peur de le dire, cet exploit industriel. Parce qu'au fond, ce qu'on leur demande de faire, c'est d'augmenter la production en 4-5 mois. Là, il fallait plutôt 18 mois à 2 ans auparavant. La base industrielle, elle existe. Nous avons en gros 16 sites industriels en Europe qui produisent ce qu'on appelle la drogue substance, c'est-à-dire le vaccin lui-même. Et donc, c'est évidemment, tous ne sont pas mobilisés, évidemment, pour les vaccins qui ont été sélectionnés aujourd'hui. Certains vont l'être pour ceux que nous attendons, Madame la Présidente, et on sait qu'on a 2 candidats qui sont très bien partis, c'est là pour rejoindre le portefeuille que nous offrirons à nos concitoyens européens. Mais nous avons aussi un autre parti qui s'appelle le fill and finish, c'est-à-dire la mise en bouteille, en flaconnage, si vous voulez, qui est très compliqué. Là, on a une quinzaine d'entreprises en complément qui vont permettent de compléter l'offre industrielle pour notre continent. Alors la mission qui est la mienne, d'abord, actuellement, c'est de faire en sorte que, précisément, on a une ambition qui a été contractualisée avec les entreprises, c'est vrai encore une fois de tous les continents, qu'on aide, autant se faire que peu, les entreprises à suivre ce planning. Et pour ça, donc, la Présidente m'a demandé de créer une task force industrielle, et elle est créée, désormais, il y a une dizaine de jours. Nous avons donc, par chacune des entreprises, des collaborateurs qui sont spécifiquement dédiés, qui suivent, je dirais en temps réel, 24 heures sur 24, l'augmentation de la capacité de production, et ça se passe bien. Deuxièmement, comme vous le savez, pour faire ces vaccins, il faut beaucoup de composants. Des composants évidemment organiques, des composants chimiques, des composants mécaniques. Et là, comme il y a cette demande mondiale, il faut bien vérifier que la supply chain, les chaînes de valeur, fonctionnent. Elles sont évidemment localisées en Europe, mais pas que. Et donc la deuxième mission, c'est d'être en permanence en contact avec les entreprises pour bien voir s'il y a des manques, des goulots d'étranglement. Alors, je vous le dis tout de suite, il y en a évidemment, c'est normal. Il y a des problèmes de filtres, il faut qu'on regarde. Il y a des problèmes, par exemple, pour les vaccins à ARN messager de lipides. Il faut qu'on voit comment on peut aider. Il y a des problèmes de flacons, il y a des problèmes de bouchons. Enfin voilà, tout ça fait partie, encore une fois, de la vie industrielle, mais au moins on a une vision complète et on travaille ensemble. Troisième point, je ne veux pas être trop long, c'est évidemment permettre aussi, dans cette course mondiale, permettre aux entreprises, par exemple, qui ne fournissent pas des vaccins aujourd'hui à la Commission européenne, mais qui ont des infrastructures, de les mettre à disposition. C'est le cas, par exemple, de Sanofi, qui l'a fait avec BioNTech, donc pour accroître l'augmentation de cette capacité. Et là, on joue évidemment un rôle pour les aider à se rapprocher. Je conclurai en disant que nous avons donc comme objectif non seulement d'être prêts maintenant, dans les trimestres qui viennent, mais aussi d'être prêts, s'il fallait, par exemple au mois d'octobre, réintervenir parce qu'un variant nécessiterait un nouveau boost, comme on dit, une nouvelle dose, qu'on puisse la produire. C'est l'objet évidemment de la discussion de ce jour, mais aussi qu'on puisse la produire industriellement, parce qu'il faudra évidemment que notre capacité suive. Et puis notre objectif final, Madame la Présidente, c'est celui que vous m'aviez confié. Il est très important pour nous, Européens, il est important pour l'humanité. Je crois qu'on en a tous conscients. C'est que notre continent soit à terme, et quand je dis à terme, c'est rapidement, totalement autonome en matière de fabrication vaccinale pour nos concitoyens européens, mais aussi pour d'autres, car nous avons aussi la vocation, à travers ce projet industriel, de fournir d'autres pays, d'autres continents, et je pense en particulier à l'Afrique, et on y travaille aussi jour et nuit. Merci.
Merci beaucoup. Nous allons maintenant passer à la session questions-réponses. And I pass the floor first to Mathis Schiffers. Mathis, you have the floor. Matthijs. Yes, yes. Go ahead. Go ahead. Go ahead, Matthijs. You have the floor.
Oh, sorry, I lost connection for a minute. I've got two questions. One is the Commission wants to update contracts with vaccine makers. I read in the press release. Does this mean that you will try to renegotiate the current contracts, and what parts of it will you try to renegotiate? And why would the other party agree with this? And the other question is about the new emergency authorization system. How long will it take? Is it indeed a couple of days then that it will take to approve new vaccines? Thank you.
So perhaps on the first question, if we look forward and we assume that we will have to work on the vaccines to improve them or to bring them to the next level in order to have a vaccine that might fight effectively an upcoming variant, we need, of course, a new contract. And we have had good experiences with most of the manufacturers we have contracted with. So it is the natural way to continue within the framework we have had. What we've seen in the past, what the advanced purchase agreements are concerned, on one hand, the investment, the prior investment before production is important to boost the production capacity, but for the companies even more important is that they know that there are guaranteed doses we are taking. So if you look at the existing contracts we have right now with the 6 pharmaceutical companies, the advanced purchase investment is round about 3 billion plus 1 billion that we had added in research. But if you look at the whole volume of these contracts we do have at the moment it's round about 33 billion euros. So you see that the guaranteeing to take doses is the most important part. And in this sense, we would negotiate with the companies. So it's an approach of in the sense of the whole scenario. Is there a vaccine? Can we adapt is there a variant that is escaping? Can we adapt the vaccine? And how can we then boost the capacity in Europe? The second point was?
Emergency authorization.
Emergency authorization. And there your question was how long it's going to be in place. At the moment it's in place till end of March.
Okay. We now pass to Marco Bressolin.
Thank you. Thank you very much. Can you hear me?
Yes, go ahead, Marco.
Okay. Marco Bressolin from the Italian newspaper La Stampa. I have a question for President von der Leyen. Some regions in Italy say that they are in contact with brokers for the direct purchase of vaccines that have already been approved by EMA, such as Pfizer or Astrazeneca. Do you think it is possible, or is there a risk that is a fraud, as reported by Olaf? And the second related question, have you clarified if Germany has bilaterally purchased 30 million doses from Pfizer, as announced by the government in the past months? Thank you very much.
So perhaps on the second question at the beginning, there's a very clear, it's very clear in the contracts we have with the member states. The member states are not supposed to have bilateral negotiations with the pharmaceutical companies. If this would be the case, they would have to notify, and I have no knowledge about any kind of side contract or topics like this. We are within the framework we have agreed on together as EU 27, and it's sensible because with the purchasing power of 27, we were able to agree on this enormous volume I've just described, 2.3 billion doses for the European Union and its neighbourhood. Actually, with the 300 million doses of Moderna today, it's even more. So within this framework, we are all moving, and I've not been notified, the Commission has not been notified of anything else. What the topic of fraud is concerned, and yes, I've heard the one or the other incident there that doses have been offered. So first of all, I think in a crisis like this, you will always have people who seek to benefit or to profit from the problems of others. And we see a growing number of fraud and fraud attempt related to the vaccines. We're fighting this trend. Olaf is investigating and giving member states advice how to identify this fraud. Our goal is to bring them to justice and to really go in depth in these matters. On the general topic, you're speaking about Pfizer, for example, being offered by traders. There's zero guarantee that the vaccine is really in the vial or not. So it's extremely risky to take such a product that is not clearly identified. You have no clue what travel it has done over time, whether the cooling chain, for example, has always been respected. If you buy it on the black market, of course you take the risk if anything happens. And we should not forget, a vaccine is injecting, if it's a vaccine, a biological active substance. If it's something else, it's another substance, into a healthy human being. So it's a huge responsibility that comes along. And therefore, there's a good reason why we have these detailed tracking systems and these detailed logistic chains, for example, for the Pfizer vaccine. So it is very important that we investigate on that, but I can only warn what these vaccines are, so-called vaccines are concerned.
Thank you. We now move to Markus Becker. Markus, we cannot hear you. Mic source seems to be wrong. Hold on. Whilst you're sorting out your mic source, we will go to Gillian Deutsch. Gillian, we'll come back to you, Markus.
Thank you so much, Eric. I have two questions. The first is part of the HERA Incubator proposal. The communication says the Commission would mobilize all necessary funding for the purpose of buying more coronavirus vaccines. I was wondering if you could elaborate on how much money the Commission needs and where it is going to come from. The second question I have is about the state of play over supply issues with AstraZeneca. We know that AstraZeneca had only one facility designated to create or to manufacture the drug substance for vaccines in the EU. We also have seen reports that AstraZeneca would get doses from India to make up the supply shortages in the EU. I was wondering if you could give us any updates on discussions with the company and what the Commission is doing about its contract with AstraZeneca. Thank you.
Yes, Gillian, I take the question with the money. I have already answered it partly, that for the companies it's more important that we guarantee to take a certain amount of doses than the upfront payment. Of course, the upfront payment in the contracts we have right now have been done by the European Commission with easy money. But the doses themselves are being bought by the respective member states at the later stage when the doses are being delivered. So this combination is important for the companies, and for them, this guaranteeing that we're going to take a certain amount of doses is important for the investment decision they are taking now. In general, compared to the huge economic damage this virus causes, a heavy investment is always justified. The AstraZeneca question, Thierry, you want to take it?
No. course, we are not exactly at the HERA Incubator, which is extremely important to prepare for the variant, but still, you're right to raise a question, because we have seen, let's say, a slow ramp-up in AstraZeneca. They have a very important factory here in Belgium, by the way, so I visited myself this factory last week, and I could tell you that I spent a lot of time with a team, and the yield, in other words, the capacity to produce the right number of doses is drastically increasing. And for what it was before I came, and now for the new batches, it's an improvement of roughly 50%. So that's why we are more secure on the fact that AstraZeneca is catching up. They have also another factory in Agnani, in Italy, and then, of course, we are confident that they will be able to catch up. And, of course, you could count on me. I am behind them on a daily basis to make sure that they deliver. The good news is that I see a lot of progresses.
Thank you. We tried Markus Becker once more. Markus, I hope you have been able to solve your mic issue. Go ahead. Go ahead. No, I'm sorry. Then we will go to Bernd Riegert. Bernd. Same issue? Bernd? Technology is not always easy.
It's okay. We have time.
Okay, I will go to an old hand of this press room who knows the system inside out, Athanasios.
Hi, thanks for this.
Voila.
Simple question, very simple question, because many of my readers have this inquiry as well. If we had the chance and if we had the means or the system to go faster in the regulatory process, why didn't we go faster in the first place? And I mean in the spring with Emma and with everybody else. Thanks.
So I will take a part, but perhaps you want to come in then, Stella, too. We should not forget that, indeed, the figure was mentioned already. Normally, to produce a vaccine takes 5 to 10 years. And normally, the approval process takes approximately 6 months. Depends a little bit on the drug that is to be approved. So the reduction of the process down to 3 to 4 weeks, where we are right now, is already enormous. A big step forward. Important is the process itself, because these were completely new vaccines, the ones who are approved right now, so the mRNA or the vector vaccines. And it is in the interest of the people who are being vaccinated that there's a thorough understanding that this vaccine is not only effective but also safe. And therefore this process is so important. But what we're going to do is look into the process without losing content, where you perhaps can better synchronize steps. And by that I mean we might change the regulatory framework to enable EMA to do that. With the view on the variants, there you do not need the whole approval process anymore if you have an updated vaccine, because now there is a bottom line knowledge on, for example, the mRNA technology, and you only need to look at what is the incremental improvement or change that occurred, and is that still effective, and is it safe? So there I think we can reduce the procedure on top. Stella, you want to add something?
Yes, just very briefly to add, of course, on what the President has already covered, that we mustn't forget that we were dealing with totally new vaccines and vaccine technology, and this is something that needed to go through, of course, the safety regulatory framework that the European Medicines Agency provides. I want to also here say that the European Medicines Agency was having rolling reviews of the vaccines before even conditional emergency authorization had been applied for, and we used with the member states all the greatest use of the regulatory flexibilities available. In what we are discussing today, the HERA Incubator, we are looking now at vaccines that may need to be adapted for the variants. So you are able to use the current way, the regulatory framework that was used, and just clear with EMA and the industry that they can do this with a smaller set, I would say, of additional data. So this is about now really modifying the way that the regulatory framework will be used if we're going to be working for vaccines which need to be changed, updated, or in any way to deal with the variants.
Perhaps I can take the floor again, and afterwards I'm going to give it to Thierry, but I have one more point that is important. What we saw in the data was a variety of quality, if I may say so, over the last months, and you followed up all the reports on the different vaccines with problems with the data quality. What means data quality? It's whether you compare apples with pears, or whether you have a standardized approach, whether all the age groups are included, all the different specifics of patients, potential patients are included. So we have been struggling a lot with that. And therefore, it's so good that we have now, as of today, the start of the clinical trial network in Europe, because then you have an automatic guarantee of a very standardized approach to testing these potential new vaccines. This is an adding factor too. Thierry had one point more.
Peut-être pour Athanasius, pour ses lecteurs, puisqu'il voulait quelques éclaircissements pour ses lecteurs, Athanasius. C'est vraiment l'un des grands intérêts, comme l'a dit la présidente de l'HERA Incubator, d'avoir vraiment tout le monde en réseau. Et pour répondre très précisément à la question, enfin, donner un autre éclairage, je dirais. Parce que j'ai posé moi-même aussi la question quand je suis allé sur le terrain aux spécialistes. Et il y a quelque chose qu'ils m'ont dit que je n'avais pas identifié. C'est qu'on a commencé en particulier pour beaucoup d'entreprises les essais cliniques, notamment courant de l'été. Et il se trouve que, comme vous savez, l'Europe était alors confinée, quasiment totalement confinée, et du reste ça a bien marché parce qu'on a eu un nombre qui a beaucoup décru de nos concitoyens qui ont été contaminés. Et donc, il a fallu plus de temps pour avoir précisément accès à la capacité de tester. Ça a été un élément qui a reculé un peu les choses. Alors maintenant, sur le variant, puisque c'est vraiment le sujet principal, ou clé, il se trouve que dans les trois technologies que nous avons en portefeuille, l'ARN messager, l'adénovirus et les vaccins à protéines recombinantes. Le premier, l'ARN messager, qui a été le premier à fonctionner, est prometteur, précisément, c'est ce que vous disiez, Madame la Présidente, parce que s'il y a des mutations au niveau génétique, et on pense tous évidemment au variant sud-africain, le fameux 501V2, il suffira, c'est sur quoi les scientifiques travaillent, de modifier quelques éléments pour qu'il retrouve son efficacité, sans pour autant changer tout ce qui entoure et qui est très compliqué. Ce sont les nanoparticules lipidiques. C'est très compliqué. C'est presque plus compliqué à fabriquer industriellement que la substance elle-même du variant. Donc ça a déjà été agréé. Et donc on n'a pas à y repasser une deuxième fois. En revanche, il va falloir évidemment avoir l'agrément du nouveau vaccin qui aura pris en compte ce variant, mais on aura gagné beaucoup de temps parce qu'encore une fois, on va tester uniquement les éléments qui changent et pas l'ensemble de la molécule. C'est donc une raison, là encore, qui nous permet d'accélérer par rapport à ce que vous disiez tout à l'heure, tout en garantissant, ce qui est absolument fondamental pour nous, en Europe, garantissant la sécurité de nos concitoyens. C'est vraiment fondamental et c'est pour ça qu'on prend un peu de recul et de retard peut-être par rapport à d'autres, parce que pour nous, c'est quelque chose sur lequel on ne transige pas.
Thank you, President. If you allow, I will read out the question from Markus Becker, since he has problems with his microphone. He has two questions, in fact. 2.3 billion doses had been ordered already. Why order still more doses from Moderna? Is it because of concerns about the quality of AstraZeneca and other non-mRNA vaccines? That's the first question. And then, why does the attempt to boost production and secure supply lines start only now? Why were these steps not taken during the summer?
Yes, supply. Okay, so indeed, 2.3 billion doses already. Behind it are two things. At the very beginning, we had no clue which one of the 6 potential candidates would make it. We were very lucky, and actually this is one big success of our vaccine strategy. At the very beginning, we had over 160 different candidates or applicants for being funded and supported by the European Union. We narrowed it down to around 30, and we chose out of them 6 where we have the contract now. We are negotiating with 2 more, and of these 6 we have the contract. 5 will for sure deliver within this year. The 6 we have to see. So this was very successful, and at the very beginning we had no clue whether this would be possible or not. We could have ended up with only one provider, for example, and then you see that it is necessary to have wide number. There's a second dimension in it. We have from the very beginning counted more doses because we wanted to be able to supply also to our neighborhood, from the Eastern Partnership to the Western Balkan to Africa. And there are 2 tracks. It's either by doses in kind or, very important for us, through COVAX. That's the reason why we created COVAX. A year ago, COVAX was not existing. And in COVAX, we do fund with money. Europe is at the moment Team Europe is at the moment being the largest funding partner. We are very much counting on the United States now to join COVAX. But these additional doses, if we get them over time, are as well as for the European people as for our neighborhood. And now the third or new factor is, of course, if we will negotiate further contracts, there will automatically be the thought of the variant and improved vaccines in it. This is for us important. The second BioNTech contract includes already this element, the Moderna contract too. So I think we have to put our mindset in a way that it's not a vaccine is there and we're over with the whole story, but that we'll go into a race against that virus that is raging around the world, and by being more and more contagious, the possibility for the virus to mutate is there. So we will always have to be vigilant to be able, if there escape mutations, to fight them with improved vaccines, to produce them, and mainly over time to vaccinate ongoing the vulnerable groups in the population. The supply chains, you wanted to...
Quickly,
yeah.
if you want.
Yes.
We had 6 candidates. And of course, before, let's say November, or the end of November, we didn't know who will be the first one to be ready. For us, as you know, it has been, I think, Stella, end of December that we get the authorization for the first one. So then, of course, started really the ramping up of the industries. And of course, before it was impossible to identify the bottleneck where we will have some problems for the supply chain. Same thing, by the way, for AstraZeneca. And as soon as we got the approval, few days after, President, you tasked me with this mission. I went on the ground, and we started to discuss. So I really think that in the time frame, if we look at what happened over the past 6 weeks. I mean, we have been on the ground and now, of course, ready to work with them and identify. But unfortunately, here and in industry, everything has to be done step by step.
Perhaps not, I recall the question now, Markus Becker, sorry. You were asking why not earlier, and rightly so. We should please keep in mind, first of all, of course, it's the genuine task of the industry, but what we did at the very beginning, we invested heavily in the advance purchase agreement that we paid upfront to the 6 companies, 2.9 billion euros, in order to have them boost their capacities and get their supply chain in order. But what Thierry said is also true. The whole world is asking for this raw material now or the components now. So therefore, this will be an ongoing struggle. But we have invested heavily to boost the capacity. If we would not have done that, the deliveries would be way lower today than they are.
Thank you. Nous passons maintenant à Christian Spielmann. Christian. Will be in French.
Oh. Oui. Ma première question porte sur les autorisations. Et dans votre introduction, vous avez insisté sur l'aspect le plus important, qui était la confiance. Alors, je voudrais savoir si aujourd'hui, vous jugez pas dangereux d'accélérer les autorisations quand, sur les 3 vaccins que nous avons aujourd'hui disponibles dans l'Union européenne, il y en a au moins un qui n'inspire absolument pas confiance, c'est le Astrazeneca. C'est-à-dire que le Astrazeneca, qui est un des plus faciles à utiliser, est déconseillé pour les 55 et plus, ce qui est quand même une grande partie de la population qu'on veut vacciner en priorité. Donc est-ce qu'accélérer les autorisations, ça ne risque pas d'accélérer justement la défiance du public dans des vaccins dont ils ne sont absolument pas sûrs? Et on a la deuxième question qui s'y raccroche, le fameux vaccin Sputnik, dont on ne sait absolument rien et que tout le monde présente comme la panacée. Ma seconde question pour M. Breton. En fait, si j'ai bien compris, cette pandémie, elle est là pour durer très très longtemps. Je pense qu'on est aujourd'hui dans la situation d'une grippe pour laquelle il faut se vacciner chaque année. Alors, est-ce que l'Union européenne sera autonome pour fabriquer ce vaccin et en même temps continuer à vacciner les autres vaccins dont on a besoin dans l'Union européenne? Est-ce que votre capacité, vos centres de production vont pouvoir monter en puissance pour assurer chaque année quasiment 450 millions de doses pour l'Union européenne, plus ce qu'on veut donner au voisinage? Merci.
Yes, I start again with the authorization. Perhaps I have not been clear enough. Don't get me wrong. It's not one size fits all authorization. It's a very differentiated approach towards authorization, and indeed sometimes it can take very long. The point is that if we have an incremental change of the vaccine that is targeted and that only needs a reduced additional information or data, then of course you can reduce the time, but being thorough is, where what safety is concerned, of utmost importance. Sputnik, thank you for asking that. So I always observe that here and there are ongoing news as if Sputnik would have applied with EMA, by EMA. It is not the case as we speak right now. It may change, but so far they have not applied for conditional market authorization. If they do that, they have to submit the whole set of data, indeed go through the whole scrutiny process. We were just discussing, like any other vaccine too. And there's a second point. They are not producing in Europe. So, of course, there should be an inspection process on the production sites. Because as we've learned now, over time, one of the very crucial points is to have a stable and high-quality production process. I've learned with the new vaccines that at the very beginning they had to throw away batches because the production process was not stable and didn't bring the yield and the quality that was necessary. So the second point is inspection of the sites. Overall, I must say, we still wonder why Russia is offering, theoretically, millions and millions of doses while not sufficiently progressing in vaccinating the own people? This is also a question, I think, that should be answered.
Peut-être pour M. Spillman, pour la deuxième question. En fait, ce que vient de dire la présidente sur Sputnik fait une bonne transition, parce qu'en fait, je le dis avec à la fois du recul et de l'humilité. Le problème pour nous aujourd'hui, et je mesure ce que je dis, c'est plus les vaccins, c'est la disponibilité des vaccins. Bien sûr, plus on en a, mieux c'est, mais enfin, on a un portefeuille très large. Et pour maintenant, j'espère bientôt, 4 ou 5 d'entre eux, on sait qu'ils fonctionnent. La fabrication, c'est un autre sujet. C'est très compliqué. Si vous prenez l'exemple de Sputnik, les Russes sont de très bons scientifiques. C'est un vaccin adénovirus avec une caractéristique, c'est qu'il a 2 adénovirus différents pour la première dose et la deuxième dose. C'est-à-dire qu'il est 2 fois plus compliqué à fabriquer. Et donc, il faut avoir ça en tête. Et c'est la raison pour laquelle, du reste, beaucoup vont venir nous voir en Europe pour nous proposer sans doute des vaccins. Mais comme l'a dit la présidente, on accueille tout le monde, mais on a des règles très strictes en matière de sécurité. L'ambition qui est la nôtre, et on va la traduire, Christian, avec quelques chiffres, si vous le voulez bien. C'est clairement l'ambition de l'HERA Incubator. C'est le travail d'aujourd'hui. C'est vraiment d'évaluer les besoins que nous allons avoir, d'abord pour faire face à cette vague, éventuellement être prêts pour les variants, et puis accroître notre production pour tous ceux qui nous entourent. Et on est en discussion très approfondie, très avancée, avec aujourd'hui tous les candidats vaccins, je le dis, et d'un point de vue industriel. Sur les vaccins ARN messagers, la capacité en Europe va monter très significativement. Je connais un certain nombre de sites, je ne vais pas en parler aujourd'hui, mais je sais que les entreprises ont ça dans les tuyaux. Il ne s'agit pas, comme j'ai dit tout à l'heure, encore une fois, de démarrer des sites de zéro, il s'agit de remettre à niveau. Et oui, je pense que la capacité du milliard en ce qui concerne l'ARN messager, elle sera atteinte en Europe, c'est certain. Alors évidemment, nous, on va faire en sorte que ça se passe le plus vite possible. Sur l'adénovirus, c'est la même chose. Et puis on a enfin les protéines recombinantes, où là, il y a aussi, encore une fois, une capacité. Donc oui, l'objectif, c'est évidemment, et c'est un objectif qui est tenable, je le dis vraiment très sincèrement, après avoir fait tout le travail que vous savez. Cet objectif, il est tenable, il sera atteint, et bien sûr, l'ambition, c'est d'avoir également la possibilité pour la suite. Je ne sais pas si vous avez raison de dire qu'il faudra se faire vacciner tous les ans. Personne ne le sait aujourd'hui. En tout cas, ce qui est certain, c'est que quand on regarde ce qui s'est passé au cours des dernières années, désormais, il faut absolument avoir dans la sécurité, j'allais dire la souveraineté en matière de santé de l'Union européenne, il faut évidemment qu'on ait une capacité à répondre quasiment dans l'instant si ça se produit. Et donc, l'un des objectifs de l'HERA, que m'a confié la présidente, c'est de travailler aussi avec les industriels pour qu'on ait en permanence la disponibilité multitechnologie. Je dis bien multitechnologie, on voit qu'il y en a plusieurs qui soient prêtes pour pouvoir répondre aux besoins qui seraient les nôtres. Et je le redis encore une fois, pour nous, mais aussi pour les pays qui nous entourent, et en particulier l'Afrique.
Let me perhaps read out the question which we received from Bernd Riegert, since it also relates to the Russian vaccine. I would like to know what you think about the Hungarian approach to approving the Chinese and Russian vaccines in an emergency mode. Should other member states follow the example, or EMA itself?
Thank you for the question. As the President said, the Russian vaccine, Sputnik, has not applied to the European Medicines Agency for conditional marketing authorization. They have sent for scientific advice, but not for conditional marketing authorization. It is very clear for us that the member states are within the contracts, within the agreements that we have signed, are part of the advanced purchase agreements for all the authorized vaccines that have been already authorized. We have the 3 now, and Johnson & Johnson applied yesterday. Other member states have, if they form an agreement to use the Russian or the Chinese vaccine, this is at their own responsibility of the member states, as these vaccines have not been authorized by the European Medicines Agency. And if I may be allowed just to add one point that I think is crucial when we're discussing the importance of conditional marketing authorization, and we have touched upon it in terms of the safety issues. First of all, when we're talking about making the regulatory framework, accelerating it, we are talking about vaccines that have already been authorized to a large extent, and we're looking at how they need to be changed to look at the variants, and this will be able to be done in a more flexible way. But secondly, this process allows for pharmacovigilance, and it's something we must never forget, because it's a very important part. When the vaccines are going through the European marketing authorization and are approved and used in the member states, then the European Medicines Agency, industry and EMA follow up all the cases that we need to do in case of any difficulties or side effects. Any member state that uses vaccines which have not been authorized by EMA does not have this pharmacovigilance in place. And this is a very important part of, as the President said, any massive vaccination strategy when you're using vaccines on healthy people. So, thank you.
Thank you. I now move to Griselda Pastor.
Merci beaucoup. C'est Griselda Pastor de la radio espagnole SER. J'ai bien compris les problèmes de la production industrielle que vous avez expliqué très bien depuis les derniers jours. Mais ce que je ne comprends toujours pas, c'est pourquoi les compagnies n'ont pas exposé ces problèmes au moment de signer les contrats. Et donc, d'une certaine façon, je suppose qu'elles ont raison quand elles disent qu'elles ne peuvent pas fournir ce dont elles s'étaient engagées à fournir. C'est ça exactement. Et ce n'est pas une contradiction de dire qu'on arrivera quand même à la fin de l'été à un 70% de niveau de vaccination à niveau européen.
Yeah.
Merci.
Well, it's hard for me to argue for the companies, but as far as I understand, in many talks we had with the companies and the CEOs and the scientific CEOs too, that of course for them, they had to learn too. This was a complete new field they were engaging in with the new vaccines. And there's a second factor we should not underestimate. You might recall that last summer we thought we would be lucky when we have the beginning of vaccines in April around Easter this year. That we had them at the very end of last year shows that science kind of overtook the industry. They were faster than the industry and the industrial production. That is one of the reasons why BioNTech and Pfizer, for example, at the beginning of December, announced worldwide that they have to reduce the expectations on deliveries. So science was phenomenal. Industry was really good. The whole process was incredibly fast, which is good. But, of course, we have to fight with many detailed problems, bottlenecks, delays, which we do overcome step by step, but it's an ongoing learning process. This learning element also, of course, feeds deep into HERA Incubator. This helps us a lot. We have been convening with the CEOs, with the scientists, with the epidemiologists. It helps a lot to really identify what are the common difficulties where we can support and help and where we join forces.
Maybe,
yeah, sure.
Brizella, since you raised your question in French, maybe I will answer quickly. And just small add-on in French. Un petit peu en français, très rapidement, ouais. Parce que ça revient à ce qu'a dit tout à l'heure la Présidente. Les entreprises se sont mises en capacité de produire. Et donc, elles ont investi en amont. Donc il faut bien, pour répondre à la question très précisément, elles ont donc commencé, par exemple, à acheter des cuves, des grandes cuves de 1000 litres, qu'on appelle des réacteurs. Mais évidemment, elles n'étaient pas remplies, parce qu'on attendait d'avoir l'autorisation des vaccins. Donc pendant toute cette période où on a préfinancé, elles se sont mises en capacité de produire en s'équipant. Et puis quand les autorisations sont arrivées, à ce moment-là, on a pu commencer à se mettre en capacité de produire. Et c'est là où, pour des raisons qui sont souvent inexpliquées, et je parle un peu en ancien industriel que je suis, vous avez des usines qui partent très bien tout de suite et d'autres moins bien. Et il faut avoir ce qu'on appelle une courbe d'apprentissage. Et on l'a vu, et c'est cette courbe d'apprentissage qui est indispensable, qui est un phénomène qui est inhérent à toute production de masse que nous sommes en train de vivre. Mais ça dure, je dirais, pardon de le dire comme ça, mais la bonne nouvelle, si je puis dire, c'est que ça dure que quelques semaines, parce qu'au bout d'un moment, le système s'auto-améliore, les équipes aussi, il y a aussi des équipes. Il faut penser que derrière tout ça, il y a des hommes et des femmes. C'est extrêmement minutieux. Apprennent, tous les processus sont bien minutés, et puis on réussit à augmenter, comme je vous le disais, ce fameux yield pour arriver. Donc on a bien les deux phases. La première phase où, grâce à l'investissement de la Commission, les usines se sont mises en pré-préparation, et puis après, dès que l'autorisation était là, alors pour effectivement les vaccins à ARN messager, eh bien la courbe d'apprentissage est plus rapide. Ce qui est très compliqué, c'est la fabrication, je disais tout à l'heure, des lipides. Ils ont pu le faire avant, parce qu'il n'y avait pas encore la formule finale qui était approuvée. Et puis, c'est vrai qu'on a eu moins de problèmes, on peut le dire, sur les vaccins à ARN messager dans la phase de ramp-up que sur le vaccin à adénovirus, mais pour des raisons qui sont essentiellement liées à la fabrication. Mais comme je le disais, on progresse.
Nous passons à Thomas Mayer. Thomas.
Yes, can you hear me?
Ja, wir können's.
Hello?
Yes, we can hear you.
Can you give me a sec? Okay. Thomas Mayer vom Standard. Ich hätte eine Frage an Frau Präsidentin von der Leyen. Sie sind ja jetzt im Laufe dieser Pressekonferenz schon unheimlich stark in die Details der Impfstrategie eingetreten. Meine Frage ist ein bisschen allgemeiner und einfacher gleichzeitig. Es hat ja viel Kritik, vor allem an der Kommission gegeben, aus einigen Mitgliedstaaten, wo man argumentiert hat, dass es vor allem ein viel Versagen der Kommission gegeben hätte beim Einstieg in diese Impfaktion. Gleichzeitig sehen wir, dass zwischen den Mitgliedstaaten sehr, sehr viel nicht funktioniert bei der Umsetzung der gemeinsam beschlossenen Impfstrategie. Also nicht nur jetzt bei den Impfstoffen, sondern auch bei der Anerkennung von Tests, bei Quarantänemaßnahmen, Grenzkontrollen und so weiter. Meine einfache Frage in dem Zusammenhang an Sie ist, welchen Vorschlag hätten Sie eigentlich, dass die Zusammenarbeit der Regierungschefs der einzelnen Staaten und der Kommission und natürlich auch aller Institutionen besser funktioniert, damit Europa insgesamt effizienter wird bei der Bekämpfung dieser Pandemie. Denn es ist ja offenliegend, jeder kann das sehen, dass Europa hier größte Schwierigkeiten hat und dass die Probleme eben nicht nur in Brüssel oder in den Institutionen liegen, sondern eben auch zwischen den Mitgliedstaaten. Was könnte man tun, dass über die europäischen Räte hinweg, wo in den vergangenen 6 Monaten das Thema Corona eigentlich relativ wenig behandelt worden ist, dass man da effizienter zu gemeinsamer Zusammenarbeit kommt. Dankeschön.
Ja, vielen Dank. Also erstens in den letzten, ich glaube jetzt seit Juli, wenn mich nicht alles täuscht, ist der Europäische Rat, der jetzt auch fast monatlich tagt und meistens jetzt in der VTC, ist das Thema Corona auf der Agenda. Und ich glaube, was wir sehen, ist, diese Viruspandemie ist eine gigantische Herausforderung für alle. Und es gilt immer wieder auch mit all den Schwierigkeiten, mit denen wir kämpfen müssen, dass wir zusammenstehen, dass wir zusammenhalten und dass wir zusammen diese Schwierigkeiten überkommen. Und wenn ich mir anschaue, im Gesundheitsfeld hat die Kommission eigentlich ganz wenig Zuständigkeiten. Deshalb ist es also wenig Kompetenzen. Deshalb ist es auch ein großes Zeichen der guten Zusammenarbeit mit den Mitgliedstaaten gewesen, dass wir so weit gekommen sind. Ich sehe es als Erfolg an, dass wir erstens zusammen die Impfstoffe bestellt haben. Stellen Sie sich nur einmal vor, jetzt, während wir hier sprechen, hätten 4, 5 Mitgliedstaaten Zugang zu den knappen Impfstoffen. 4, 5 Mitgliedstaaten hätten überhaupt gar keine Chance, überhaupt eine Dosis zu bekommen. Und der Rest ist irgendwo dazwischen. Das hätte Europa zerrissen. Das wäre das Ende der Gemeinschaft gewesen. Und es hätte auch unseren Binnenmarkt vollständig zerstört. Denn da ist keinerlei Logik dahinter. Wenn ein Land theoretisch vollkommen durchgeimpft hat und um das Land herum in der Europäischen Union würde weiter das Virus wüten, würde die Wirtschaft nicht in Gang kommen und wir hätten immer über Mutationen, Reinfektionen. Das heißt, wir kommen auch zu keiner Lösung. Also unterm Strich, dass wir gemeinsam bestellt haben, dass wir auf die richtigen Impfstoffe gesetzt haben, dass wir gemeinsam uns jetzt bemühen, mit der Industrie die Anfangsschwierigkeiten zu überkommen. Ich glaube, wir können darauf auch stolz sein und wir sollten auch, glaube ich, uns daran erinnern, dass es auch hier Erfolge gibt, die wir miteinander feiern können. Ich kann vollkommen verstehen, dass die Menschen dringend auf diese Impfung warten und dass es eine erhebliche Frustration gibt, dass es einfach dauert, bis die Impfstoffe kommen. Aber unterm Strich hat hier die Europäische Union zusammengehalten und wir werden auch weiterhin zusammenhalten, unabhängig davon auch, wie die Herausforderung jetzt mit den Mutanten ist. Ein zweites Beispiel, das zeigt, dass Europa in diesem Sturm auch den sozusagen Fragmentierungstendenzen standhält, ist Next Generation EU. Denn wir dürfen nicht vergessen, neben der Gesundheitskrise haben wir eine schwere wirtschaftliche Krise. Und allen Unkenrufen zum Trotz ist es uns gelungen, zum allerersten Mal eine gemeinsame europäische, kraftvolle Antwort zu geben auf diese schwere Wirtschaftskrise durch Next Generation EU, 750 Milliarden Euro, die die Staaten garantiert die Kommission aufnehmen wird am Markt und die wir gemeinsam in die Mitgliedstaaten investieren werden. Auch hier haben Sie mitverfolgt in den letzten Wochen und Monaten, wie schwierig es war, zusammenzukommen. Aber wenn man sich die Alternative vorstellt, die Fragmentierung in Europa, die Entwicklung der Disparität zwischen denjenigen, die Zugang zu Finanzmitteln haben und jenen, die nicht Zugang zu Finanzmitteln haben, das ist ein Szenario, was ich mir gar nicht ausmalen möchte. Ich glaube, dass wir sicherlich in der Zusammenarbeit bei einem Punkt immer wieder auch uns ermahnen müssen, das ist, wenn Beschlüsse getroffen worden sind. Und oft kommen die daher mit dem Begriff Recommendation. Aber wenn diese Recommendations angenommen worden sind, durch nicht nur die Kommission vorgeschlagen, sondern auch durch den Rat, dass es wichtig ist, dass sich alle dann auch daran halten. Wenn man in der Krise schaut, wo sind die größten Schwierigkeiten, dann, wenn wir uns an die gemeinsamen Beschlüsse nicht halten. Aber das ist auch eine Frage, die immer wieder untereinander in den verschiedenen Räten diskutiert werden muss.
Thank you. We move to Louise With. Louise.
Yes, do you hear me?
Absolutely. Go ahead, Louise.
Thank you. Thank you for the question. In the press release, there's briefly mention of the fact of the need to ensure manufacturing capacity by building up the EU FAB project. So I wonder if you could put a few more words on that. How do you envision this capacity? Do you want the EU to build and own its own factories? Do you want to lease capacity from private producers, or how would this work? Thank you.
So maybe I will comment on this because this is a very important subject for the HERA Incubator. First, you understand that we focus our efforts on our ability to help companies to scale up their production in the three categories of technologies that I described. And you understand and you can feel with my body language that I am comfortable, that we will do it. But then we need to be prepared for eventually something which could happen in the future with maybe a new pandemic, a new virus. And we don't know, of course, what kind of technology will be needed. So the discussion we have already engaged with the President. And I could say, President, that we didn't wait this year to engage this. We already had this discussion before, together, because we were already thinking of what next. But it takes time. It takes time because we are talking of companies. We are talking of big investment. We are talking of also for these companies of the way to prepare themselves. So for this EU FAB, what we would like to put in place is, of course, a network of all the industries which exist today on our soil in continental Europe. And I should tell you that if everything goes well, and everything will go well, because I know the efforts that companies are putting behind, we will be probably one of the first continents in terms of manufacturing vaccines. But of course, we need then to find the right tool to make sure that we'll be able to keep this up and running if something happens. And this is where we need, of course, to find the right governance structure, including maybe funding, and we have tools, of course, in the Commission, to maintain, of course, this being totally operational, 24/7, in order to make sure that this will be ready when it will be needed. So this is, at large, if I may say so, the model that we have behind. But first, companies are doing their job. And then we are working with them to create this network and to see if we need to do additional things to make sure that we'll be able to have those three technologies that I mentioned available for us in Europe, but also for others.
Thank you. We move to Diego Velasquez, Luxembourg. Diego.
Yes, okay. Thank you for your time. I have a question related to COVAX. On the new announcement of the new doses you made, Madam President, are numbers automatically allocated to the COVAX program, or will it be like this, that you first deliver for the EU and then look at what is left and then think of COVAX? And my second question is, when you evaded before, how do you find it that governments like the Hungarian one are actually proud of sidelining the European way of buying and providing vaccines? Thank you.
Yes, what COVAX is concerned, COVAX has been founded, you might remember we had the pledging sessions in May, 2 pledging sessions where we had 16 billion euros that were pledged to fund the ACT Accelerator, working on vaccines, therapeutics and diagnostics, and COVAX. By now, COVAX is covering 92 low and middle income countries. I think more than 180 countries have joined COVAX. And the most important principle is to fund COVAX. COVAX itself has been and is negotiating with pharmaceutical companies. As far as I recall, they just a few days ago published a press release where they said that they now will start distributing vaccines through COVAX. This is good news. So funding is the very first and most important step forward. COVAX itself for this year has been funded by 2 billion so far. They would need 7 billion. By this, I want to say they need way more funding, and it is good that in the next days we hopefully will increase the funding of COVAX in the different settings that are coming up. So having said that, of course, for the European Union, it is important to share, if possible, doses also through COVAX or with the neighborhood. Therefore, we have started to work on a sharing mechanism among the member states. At the moment being, it is still very difficult because, as you have seen also in this press conference, we're still struggling to get started. But I think with both mechanisms in place, COVAX itself and the sharing mechanism, we will be able to work with our friends and neighbors. I have one more point in this HERA Incubator thought that might fit also to this topic right now. I think over time, from the very beginning, we have to think in parallel that we're not only working on capacities to boost them in Europe, but also to think in parallel where, for example, in Africa, are potential capacities that can be boosted or that can be improved. For example, in Senegal, for example, in South Africa. So to have immediately this parallel approach is something very important. You will find in the communication at a certain point a form of licensing that is proposed that under the ownership, if I may put it in simple words, under the ownership of the pharmaceutical company, licensing is possible. And there, for example, I think over time the best practice would be that under the ownership of the one who's producing, has developed and is producing the vaccines, licensing, for example, in capacities that are in Africa, for example, funded by the European Union or supported by the European Union, that would be the ideal approach where we are aiming at.
Thank you. We'll take two more questions, and I go to Sam Fleming.
Thanks very much for taking my question. Could I ask about the Astrazeneca contract? It is Astra where there, I think, are the most concerns about new variants because of the question mark about its usefulness against the South African variant. Are you therefore already in discussions with AstraZeneca about adapting, amending the contract? Does it require additional investment from the European Union in order to adapt that vaccine and allow it to cater for new variants, or is it too soon for that discussion? And secondly, just on this question of Sputnik again, could you just be a bit more clearer? Is basically your advice, therefore, to member states that are considering Sputnik, be it Hungary, Croatia, or reportedly Slovakia, is your advice to those member states to wait until the full authorization is obtained? Is it risky for them to go ahead with this? Thank you.
Do you want to take or should I?
Yes, for the AstraZeneca question, I just wanted to say that, of course, the European Medicines Agency is following up all the recent developments in terms of all the vaccines which have been authorized, and this includes the recent information that has been seen about the efficacy of the AstraZeneca vaccine for the South African variant, and the European Medicines Agency is following that up very closely. For the moment, what I would say is that for all the vaccines that have been authorized, one would take into account for future contracts also and we're working already with the companies for this. We need to take into account their efficacy and their data that they have for the variants, and already the manufacturers of these vaccines are looking into this. In terms of the Russian, again, vaccine, as for the Chinese vaccine, I want to say that for neither have there been a submission for conditional marketing authorization, and we are only in a position to assess the science of the efficacy of vaccines once they have gone through the independent scientific assessment of the European Medicines Agency.
Thank you. Last question for Martina. Martina Stevis-Riedner. Martina, you need to check your mic source. Yes.
Forgive me. I hope you can hear me now. Thanks very much for the question and for your time today. A question regarding the most recent round of reintroduction of border measures in the EU, but since the beginning of the crisis, we have seen the introduction of border checks or travel measures and restrictions by various member states. Most recently, in the press room, we've been talking more about Germany and Belgium. The Commission from the beginning has been urging for proportionality, scientific sort of backing of such decisions, as well as clear communication and advance warning and coordination. And it seems yet again that this has not really been the case in the most recent checkpoints and controls over border measures. I want to ask to what extent you're concerned about the way that member states are reintroducing these border measures, and whether you're worried that this is deeply impacting the functionality of the common market, the single market, as well as the free movement of people, in particular when the Commission did come out with recommendations that were adopted on this front, and it seems that they're already out the window. Thank you.
Yes, thank you very much. Just to give you some figures, you remember last spring when at the very beginning of the pandemic, when a lot of border measures were introduced, we had 17 different member states that had, not all at the same time, but that introduced border measures. And the lessons we've learned at that time is it did not stop the virus, but it disrupted incredibly the single market and caused enormous problems. That was a time when we agreed to coordinate together, and indeed now let's jump forward. In December, we were down to 4 member states who had at a certain point border measures. Now we are back to 9 different. Yesterday there was the technical briefing there, the different member states have been mentioned. So what we see here is, first of all, of course we have always to balance these two important topics. On the one hand, to protect the health of our citizen, and on the other hand, to have free movement. We see at this stage of the pandemic that it is more important to look at regions that have the same epidemiological situation. That's what we have discussed with the member states, and we have agreed in the recommendation to early inform the other regions if specific measures have to be taken, and to do that in an appropriate way to discourage people to move around, mainly if they come from dark red or red zones. And this has been a recommendation put forward by the Commission, but adopted by the Council, so by the Member States themselves. And therefore, I want to re-emphasize it was a learning process that brought us there. The virus taught us that closing borders does not stop it, but we see the disruptions, and therefore it's in our own interest to stick what we have agreed upon together.
Thank you very much. This brings us to the end of this press conference. I want to thank you all for your participation and wish you a good afternoon.